Hello everyone, I have with me today my lovely colleague Dr.Ameeta, and she is a dentist. And today we're going to talk about dentistry and facial aesthetics. Ameeta, thank you very much for taking time and doing this video with me today. So can you please tell me, when first did you find interest in facial aesthetics? Was it straight after you graduated from dental school, or was it late in your career?
Yeah, thanks for having me today. So when did I first become interested in facial aesthetics? So I remember when we did our VT year, so it's the training year we do after graduating, I was at a conference and just saw a lecture about facial aesthetics, and I was absolutely gripped. I was at the edge of my seat, and nothing else that day did that for me. Lectures about root canals or radiography, nothing did that. And I just remember thinking, this is what I want to do. At the time, I was really early on in my career, and I felt, and I was told that I should maybe sort of practice and get my bread and butter in dentistry before potentially branching out on these courses. And when I finally did get to do it a couple of years later, I absolutely flew with it and really enjoyed it. And actually, my only regret is that I think I should have done it earlier. I don't think there was any issue. It turned out that finding my sort of speciality within dentistry wasn't my thing, and this is my speciality, I feel now. That's how it all started.
Well, I can't agree with you more. I think dentistry sometimes could be a very lonely profession as well, because you are on your own in the surgery, you have your dental nurse, and over a period of time I think you lose the excitement because you're doing the same thing over and over.
Yeah.
And I think a lot of patients who come to us as a dentist, they have this fear when they're coming through the door, when you have a completely opposite when you treat aesthetic patients. Would you not agree with that?
Yeah, I totally agree. So I don't do any dentistry now, I do this full time. I understand that you still do some dentistry, is that correct?
I have been running away from dentistry all my career, and dentistry has been catching up with me. My story is slightly different to yours. I started facial aesthetics later in my career as a dentist, in fact, when I moved to the UK. But beauty industry is something that I discovered at the very early age. So when I was at university and dental school, in my first year at the university, I met a girl who was working for a skincare company, and she was building her own business where she was doing a skin consultation and recommending patient the right skincare, more of a bespoke one rather than one that is available in big chain shops or that you go and find in the shop yourself. And I found that this was very fascinating, so I asked her about this and I joined the same company. So I learned about skin back then, and then as a dentist we involved in smile design, in teeth whitening. So later on I saw that there is actually more that we can give to our patients. So it was my husband first who was practicing aesthetic medicine as a medical doctor. So through him I got introduced to facial aesthetics, and by the time I got my qualification as a dentist in the UK, I was certain that facial aesthetic will be my career path. So as soon as I got registration with General Dental Council, the next few months I booked myself an injectable course.
Fantastic.
And from there I built clinics, but also still keep my hands in dentistry. Only minimal, one session a week, but it's enough for me. Ameeta, could you please share your experience about building patient base, because I think that is probably one of the hardest things. You invest into courses, you have the right skills, but how do you get the patients? So would you share with us your secrets and give some tips on that?
Sure. I don't think there is any sort of quick fix or quick answer to building a patient list, and this is the same for dentistry or for facial aesthetics. Nobody just builds a list overnight. At the time when I started doing facial aesthetics, my first few courses that I went on, I was a full-time dentist. So I was a full-time dentist, 9 to 5. I didn't start offering facial aesthetics treatments at the practice, and I never have done any facial aesthetics within the dental practice setting. For me, it wasn't quite right. I was predominantly NHS. NHS, as we know, the treatments are fit for purpose. There are a certain level of time constraints. We're very busy, and sometimes there's not a lot of time to discuss treatments like this. So for me, it didn't fit with my 9 to 5 there. So at that point, I would sort of rent spaces and do pop-up clinics around the area. And of course, it's slower to begin with. That's normal and to be expected. I think the key is to be consistent, dedicate your time to it if it's your passion, which it is, and it doesn't feel like work to me.
No.
I don't mind. I mean, I enjoy posting about my treatment, which is part of the business, and informing my patients, contacting them, booking them in. I enjoy that whole process. And just delivering the best quality treatment you can and care for your patients. To me, that's what snowballs. One patient tells their friends and family, what an experience they had and the result they've had, and that will snowball. I remember one of the first weeks I started treating, I did someone's lips. She went for a meal that evening, and from that meal, 4 ladies had their lips done, and that just sort of shows you how it can work if you look after someone and deliver a good treatment and result.
So I think here it gives us kind of a message that we need to look at the very basics. So start with the good quality training, make sure that you are competent at what you do, make sure that you are confident at what you do, and look after your patient like you probably would look after your family.
That's right.
So,
yeah.
And then the patient will follow. So if you do the best you can, patient will find you themselves. Would you agree?
I think so. And it definitely is just word of mouth, I think, is one of the biggest things, delivering that result and looking after your patients.
The other question I have, so do you think that aesthetic market becomes overly saturated? Are you worried that so many practitioners offering the training, offering the treatments and training as well? So how does it make you feel, Ameeta?
You are quite right. There's lots of practitioners out there doing this in the UK. We know it's an unregulated market. So you do find you have a lot of medical professionals and non-medical professionals doing these treatments. I think if you are, like we said, delivering a really good treatment and looking after your patients, you have little to worry about. You set yourself apart from everyone else, and I think that the importance of really good education, educating yourself, investing in yourself in terms of your knowledge and treatments. Coming somewhere here like Cosmetic Courses, where I am a trainer, I know that we deliver top training. You're setting yourself apart from day courses from non-medical professionals. It's a different league here. So I don't worry about that, and I don't think medical professionals coming here should worry about that. It's not a main concern. I don't know how you feel about it, Dr.Olha.
To be honest with you, I always say that competition is healthy, and another view that I have, I don't think you need to worry about what other people do, and you need to worry to do the best you can. And as I said before, patient will come if you are the best practitioner you can be. So what would be your tip, Ameeta, or recommendation to the dentist who considering their career path in facial aesthetics? And do you think that we as a dentist have any competitive advantage at the starting point of our career in facial aesthetics?
Absolutely. So I do feel, and watching dentists work and teaching dentists that are new to facial aesthetics, I feel like most often they pick up a syringe and they fly with this. We are head and neck specialists.
Yes.
We both went to dental school. We spend years of our life studying this. And we inject patients in the facial area all day. We numb people up, and we're used to doing that. We're also used to looking at the patient holistically and developing a treatment plan rapidly throughout the day. So it really goes hand in hand, and I very rarely find a dentist that struggles with that. I think we are geared perfectly with our skill sets to do this. I would say any dentist who is thinking of doing these treatments, absolutely go for it. I feel like you'll really enjoy the training. We were talking about dentistry being a little monotonous before.
Yeah.
It can be the sort of the same thing several times a day, whereas this adds more variety to your treatments throughout the day. You absolutely can offer this in a dental practice. It's a great setting for it in terms of the clinical room and the ergonomics of that. So I don't see any drawbacks. I think most dentists will really enjoy it. And the vibe is completely different, which is what you were touching on before, Dr. Ola.
Absolutely, and from my point of view, I just would say you can overthink things and you can always put things on hold, but what you really should do is just to go ahead, book the course, make this first step and find out if the facial aesthetic right for you or not. What do you think, Ameeta?
Oh, absolutely. I have no regrets. I love each day. I think, like we talked about, the mood is really different. You can be sitting in a surgery and you can be breaking the news to someone several times a day that they're having to have a few teeth out, and it can be a difficult day in that way. But it's a really good vibe. Patients come in, they want to look and feel good. We carry out these treatments safely. We get great results. For me, it's a no-brainer, but I love it. It's we both love it. So,
and it's only positive vibes here.
Yeah, absolutely. That's what we're here for.